this is really, really lovely for me because Sarah Jane is one of my besties, one of my best friends. So I think some people need to mute themselves as they come on board because we can hear you rattling around in the back. So if you can see that you're not on mute, would you mute yourself? That'd be great. Thank you. Can you see who it is, Sahini? Is making that clicking noise? No. Anyway. So it's exciting for me to have Sarah Jane in this conversation. We met a decade ago, but have probably known each other so much longer in different ways. And we immediately became friends because our interests met in different ways. I think one of the immediate things that I want to name is we're both suspicious of authority and status. And anybody who's seeking to build their own identity out of status, there's an instinct in both of us to just gently try and dismantle it. We're interested in metaphysics and esoterics and energy work and a pagan and a Western mystery tradition approach to energy work. We're interested in healing and psychology, so mainstream psychology as well as a more holistic approach. We're interested in politics. We tend to come from a leftish direction. And we're interested in history, and we like reading fiction, and we both like motorcycles. And one of the theories I have is, I'm going on too long, but bear with me. One of the theories I have is that nearly everybody who's into motorcycles is a reincarnate cavalry person or horse person. And very, very often I talk to other bikers and they are also into horses and riding. But it's there's a convergence there that's interesting that Sarah Jane also buys into. So we've got all these threads, and she's been doing this training recently. We work together delivering courses, and she's been doing this training on using or companioning with horses, having horses as colleagues in a therapeutic situation, and we will talk about that. But there you go, Sarah Jane, welcome. That's my enthusiastic, like a dog wagging its tail, bringing you into this session. So thank you so much for agreeing. Where were you born? What did your parents do? Tell us a little bit about that to begin with, and we'll start with history and then move into the story further along. So tell us where you were born and what your parents did and what your childhood was like.
Okay, so it's really weird being on this side of things, because I'm normally used to being alongside you rather than being interviewed. So whilst it's lovely for you, it's weird for me, but I'll get into my flow. I was born in Doncaster, and I was born in the mid-60s in a maternity hospital, because they still existed back in the day. And my parents were teachers. My mum, when I was born, my mum was in her quite early 20s. She was only about 23, 24. And my dad was in his late 20s, just arriving at his 30th birthday or thereabouts. Yeah, so they were both teachers, and their generation, so my dad's siblings were the first generation to enter the professional world of work, because our grandparents, my grandparents, their parents were miners, steeplejacks, and worked in and around the coalfields of South Yorkshire.
And what was going on in your mouth, in your head? Because that's a crucial part of the story that
What was going on when I was born? Well,
Yeah.
so there's this story. There's a story that my mum used to tell, and I have no idea whether it was true, but I really internalized it. And it was that my mum knew there was something wrong, because apart from being in use and the forceps, one of the nurses nearly fainted, the doctor gasped, and the nurse shrieked. So
Seeing you as a baby.
seeing me emerge. So, so there's, a big piece of thing that I internalized right the way through my childhood. And, thank goodness for therapy and all these other healing practices we can do to actually go back and revisit that time. So, yeah.
Why were they shrieking?
Because of a double cleft lip, and I also think possibly because I had black hair with blonde tips. I was an unusual looking baby.
Yeah.
I was born with a double cleft lip and palate, and this black spiky hair.
But you had, how many surgeries did you have as an infant?
First surgery at 3 months, and then every year, maybe twice in some years, because they kept failing right the way through to about the age of 8.5, 9. And then they wanted to do some more in teenage years, but they kept falling out with each other about the risk, because I'd had so many failed surgeries.
What were they trying to fix inside your mouth?
Well, first of all, my cleft goes from right behind my front teeth, and it was soft palate as well. So there was no closure whatsoever in my mouth, complete open channel from right behind. So there's a gum, and there would be teeth, but completely open right the way back. So the first thing they did was ultimately they were trying to get me to be able to suck, because there was no mechanism for creating a vacuum in my mouth. And so in the first few months of life, again, the story, I nearly died from starvation. Various other things and stories about my dad making a special spoon to be able to spoon in milk, and terrible time trying to feed. So the first operation was to try and enable me to be able to suck in some way, or at least have a swallowing mechanism that wasn't completely tongue focused.
So later on as a child, as you went in for these surgeries, how long were you usually in hospital?
Well, again, back in the day, I remember being in for about 3.5 weeks. And the reason why I think it's that is because I always had my surgeries at the same time of year. They were always roughly after Easter, after the Easter holidays. I would go back to school for maybe a week or 2 or 3, and then I go to hospital. So I used to miss the month of May. Yeah.
So one of my impressions is, and I'm not quite sure where I got this, that you were the worst case of cleft palate that they had seen and experienced, and it was due to an inappropriately prescribed drug for your mum. I can't remember what the drug was.
Yes. So my mum had childhood seizures. And was put onto anti-seizure medication at the age of 4, and nobody dared ever review that. She was on phenylbarbitone of some level or another, quite a hefty dose. And when she became pregnant, she began having a sensation that she used to have in her arm that was like a warning of a seizure from when she was tiny. And the doctors prescribed, they increased her dose. And it's well known that it causes clefts now. So we're pretty sure it relates to that.
So when I'm kind of thinking about you at a distance, I'm always aware of the fact that you had these horrible surgical intrusions into your face
And down here,
and
all
down
the
there
way
as,
down, yeah, all the way down there.
as a child, and also that the way you experience the inside of your mouth and the way that you experience your voice and the way things echo or vibrate inside your skull is very different from the way most people do, because it's different for you in there.
I
And
wouldn't know that because
no, you
I'm
wouldn't know
living
that.
inside anyone's head. Yeah.
So, but what I'm trying to do is thread together the fact that as a child you also started to have psychic experiences, and at the same time, in parallel with that, you have this experience as a little girl, little creature, of these terrible surgical intrusions, plus a skull that's got strangeness in it, right? So, and in other societies, you know, the hair lip and the psychism would immediately set you up as the medicine lady of the tribe, but not in our society, right? But so when did you first start having metaphysical experiences or having a sense of the other being present to you?
I can't remember not.
Yeah.
Is the point. So nothing ever started. It was always there. But I think so this is a really important thing to mention from now. I thought this happened to everyone. I thought this was completely normal. So what I remember two things. I remember being a babe in arms carried. I remember that very, very clearly. And I remember at home at bedtime being put to bed even before my sister was born, being put into the cot. And I remember there being a man in the curtains, and if the man in the curtains was there, it was all safe, and the man in the curtains was always there. So that, you know, the curtains were drawn, but in the pattern there was this nice man who would just come and stand there, but only at bedtime, and normally only when my mum left the room, and then suddenly the man in the curtains would appear. And then when I was in hospital, I remember that there were what in my childish head I would call the real nurses, the physical nurses, and then the angel nurses, because every nurse had an angel nurse with them, a being of light. You know, so and I would sing. I just thought that was what hospital was all about, that every person had a being of light or two or three with them, you know, and being aware of that, even being really scared and really frightened and really in pain, it was sort of this phenomenon going on, really nice, really normal for me. I remember waking up at night often. My operation was often the first one of the day because I never knew how long it was going to take. And I often had a lot of blood transfusions, whipped in, hemorrhaging late at night. So they liked to get me in early. So if I was going to hemorrhage, I'd hemorrhage while they were all still at work and not when they had to be called back in. So I spent a lot of time awake at night and just sort of hopping and out. And you know what? I wonder sometimes, was it general anaesthetic or was I just, you know, literally out of my head? But I don't think so, because it was always there when I didn't have the general anaesthetic. And I just, as I say, I thought everybody saw this.
But you were also having experiences out in landscape, weren't you?
Yeah.
Yeah. When you were not on general anaesthetic.
That's right. Yeah, but
You're
yes,
having
absolutely.
you're having yeah. So how old were you when you started? Was it that from as long as you can remember you were having
Always. I always had
sense of nature spirits?
Yep. So again, being little, what do I remember? My dad saying about the fairies at the bottom of the garden. And yes, there they were. And the cherry tree, we used to have a cherry tree in our back garden. I would, in the morning, curtains figure in my life. I would, when the curtains were opened up, I would open the curtains. I'd go behind the curtains when I was little because my cot was in front of the window. I'd pull myself and go under the curtains. And there would be the cherry tree. And I would always talk to the cherry tree, and the cherry tree would talk back.
When did you learn that this was not the experience that other people were having and it might be better to keep quiet about it?
Well, I was first told to keep quiet about it probably about the age of 3, 2 or 3 or 4. I remember being carried out to church for shouting at the angels. Look, Mummy, there's angels. Look, there it is. It's up there. I really remember being told, shh, be quiet. And no, it's over there now. And then being carried out of church and being told we don't talk about that sort of thing. So again, I thought everybody was seeing this, but nobody was talking about it. And it was kind of presented to me like, we don't make personal comments. We don't comment on people's hair or eye color. We just, we accept it. And when we know them really well, we might say, well, you've got brown eyes or, So I really thought that everybody saw all of this and heard all of this and felt all of this. I thought it was absolutely normal. And then I had an existential crisis at the age of 19 at university when I found out it was not normal.
So that's quite old to realize it's not normal.
Yeah, I thought everybody was doing it in some way.
Yeah.
To a greater or lesser degree. And it was, I had a friend at university who literally sat me down and said, other people do not perceive the world like you do. That is not their reality. And this was great because it was a friend who did a load of LSD.
Uh-huh.
And I never went anywhere near any mind-altering substance other than good old-fashioned alcohol because I'm from the north and that's what we do. But also, it never quite had the money for other drugs. And then when I was around people who did, I could see what was happening. And I just thought, oh, I'm not going there. I'm not going there at all. I think I had a sense that I might get completely lost somehow. So yeah, so it was a friend who did a lot of LSD who told me, because he and I would chat about his experiences and he would say, you don't need this stuff, you're there anyway.
So when was it that you met the guy who was your teacher for a little while?
My teacher, well, after university, so I went to university and it was a big existential crisis for me. And it led to trigger warning, but it led to suicidal ideation at that time because I'd been brought up by my parents to believe that when I went to university, everything would be fine because I had all the usual bullying at school and difficulty at school and all of that. And it was made harder because my dad was a teacher at the school I went to. So I kind of lived life under this sort of lens, it felt to me like I was always under some sort of scrutiny. And growing up in a small South Yorkshire market town, everybody knew everybody. So I was told that when I went to university, first of all, I would be understood and I would fit in and I'd have lots of friends and life would all be all right. And it wasn't like that at all. It wasn't like that. I was still socially excluded. I still, I involved myself, and everybody wanted me around for work, but people would kind of disappear. I wasn't invited to things, or I wasn't invited to everything. And I was aware of that I was invited to bits but not other bits. So that was a really hard time. And I remember as I was approaching the end of university that I remember having this sense of, oh gosh, what next? Apart from doing a strange combination of English and Russian as a degree, what next? I had turned down GCHQ. What do you do? And I was faced with going back to my parents. And I think I was just kind of existentially didn't know which way was up, couldn't understand where life would go from here, really. A lot of people finish university like that, don't they? So I went for a while and lived with some family friends, and that was very helpful because they lived out in the middle of Derbyshire, and I did a lot of walking and a lot of thinking. And at that time I was starting to read. I've been reading esoteric books for about 6 years by this point. So I knew that was available, but I also knew that it wasn't a mainstream path, and we didn't talk about it because nobody else was doing this stuff.
Who was your favourite author?
At that time?
Yeah.
Oh, gosh.
Can you remember the esoteric books which influenced you the most?
Oh, I can't remember the author's name.
Well, the title?
It was The Magical Tarot, and
Is that Gareth Knight?
Pardon?
Not Gareth Knight, is it?
No.
Magical Tarot. Okay.
No, it's Magic and the Tarot.
Okay, so I've stopped your flow. Let's get back.
I can't remember the author's name, but it was Magic and the Tarot because it was all about the tarot. But what started my brain firing was the correspondence, and I thought, I know this stuff. I just knew this stuff. So
let me pause you for a second, because I'm aware that some people may not know what you mean by correspondences.
Yes.
And just let me just say to people, correspondences in energy work and magic are to do with one thing is akin to another, and therefore there's a resonance between them. So, for example, iron, Mars, red, male, courage type stuff. That's all one resonance. You'd have Venus, roses, and some sweet smelling thing. That would be another vibe. The correspondences are the different things that are similar. Sorry.
Yeah, thank you. So I went back to live with my parents. I was without direction. It was the mid-80s. There were no jobs. And my grandma, I was driving my grandma around a lot. My grandma was a spiritualist. My mum and dad hated that grandma was a spiritualist. We didn't talk about that either. But I would drive grandma to a local healer, and I'd sit in the waiting room, and then the healer would call me, and I'd be terrified about this person coming at me wanting to put their hands on me because of all the hospital experience. And I remember watching what was happening in the healing, and then I was told, I wasn't asked, I was told that I was going to meet the healer's teacher. And I sort of learned to just go along with, if grandma said it was all right, actually, generally, it was all right, because I'd met a lot of her spiritualist friends, and they were really nice people. And I always felt safe around them. They weren't in any way intrusive. And they asked me normal questions like, was I courting? Or how were my studies going? And, I just felt like I was a normal person to them. So I went and met the healer's teacher, who essentially told me that with my grandma's permission, I would go back the next day. And then I'd go back the day after that. And then I'd go back the day after that. And so for over a year, I went pretty well every day. And it started out essentially with being told. I remember a very early session literally being told which way was up, and literally how to orient myself in my body. And I already knew about directions because I did a lot of walking in the Peak District and red mats. But he kind of just literally spoke to me almost like I was 5 years old and said, this is what you're here for. This is what your body is. This is where, this is what this direction is. And it was essentially just being put straight, as you might say.
So two questions.
Mm.
Why did this person spot you to take you on as a student? And what was this person's lineage?
Okay, so I don't think I had been spotted. I think my grandma and the healer, I think there was something going on about I could possibly be a healer too, but something wasn't, I needed somebody to check me out in terms of I couldn't be a healer or I couldn't be a psychic, but nobody seemed to know what, because I didn't appear to function like anyone else. And so I went to this healer's teacher who was a Romany, English Romany through and through, real old English Romany lineage. And they just talked at me for the first couple of months and sent me away to have a think, and would ask a lot of questions. And then it dawned on me that I was being taught in the oral tradition. And then the questions started and it became a didactic exchange. And then I was brought in on cases that this person was dealing with. I don't talk about this.
No. Well, we just fast forward. So you had one-to-one teaching.
One-to-one teaching
in the Romany tradition for over a year.
Yeah, nearly a year, definitely one-to-one, and then I got a job, moved away, but I went back every other weekend and also had telephone. Yeah. It was an apprenticeship,
I think what's wonderful about that is people forget, white Europeans, white English people forget about the indigenous traditions that sit inside the British Isles landscape. And here is one, and it's very unusual to meet someone who's trained in that tradition.
And my grandparents were from that tradition.
Yeah.
And I think that was why I was taken along, not necessarily for healing, but I think something was spotted by both sets of grandparents, because they taught me the stars and the herbs, and they would never ever describe themselves as anything other than Christian.
Yeah, but how lovely to have grandparents like that. How lovely, how fortunate.
Absolutely, so I grew up knowing all my wildflowers and all of that, so that was in place as well.
I'm going to fast forward us now. So I'm going to zip us forward through being a teacher, through moving into Whitehall and becoming a fairly senior civil servant working with mental health and education, then through working, the last post was with Rethink Mental Illness. I was getting it wrong. Rethink Mental Health, Rethink Mental Illness.
Mental illness.
Rethink Mental Illness, a senior post there. And you land then now, last few years, as CEO of one of UK's biggest animal charities, the Mare and Foal Sanctuary, right? Now, you have a particular rapport with animals. So what I'd love is, why do you have this rapport with animals, and is it with all animals? And then we'll move on specifically to the work you do with horses, which you call equines in that context, don't you? So tell me, how did all the animal stuff happen for you?
Briefly back to childhood, I was obsessed with dogs and horses and having dogs and horses. It was like I only ever drew horses. And you know that thing of there's something that happens in childhood that stays with you, and what stayed with me was having a horse. But I didn't have a horse until I got to my 30s when I was teaching, because I couldn't afford it. And then when I could afford it, it fitted in with being a teacher and having school holidays, and I was quite well established at that point. So as I went through my career, that I only ever had one.
One what?
Horse, one horse, one horse, yeah. And the rapport with animals.
Yeah, how many horses? Sorry, just everybody should know. How many ponies, horses are you looking after right now? How many?
The Mare and Foal Sanctuary.
Yeah.
Yeah. So at the Mare and Foal Sanctuary, we're a medium-sized equine welfare charity. We are.
God, how many?
We're in the 12 largest animal welfare charities, and at the moment we have around about 180 on site, in sanctuary on site.
Okay.
And we have another, let's say, around about 600 sanctuary at home, living with carers in their homes. And
so Sarah Jane, the little girl who loved dogs and horses, you're now in this role where under your protection,
about
care, you've got about 600 horses, right? So that's little girl's dream come true, isn't it? Now listen, I'll go straight for the point. There's something of the Dr. Dolittle about you. Anyway, yes, anyway. Because you talk to your animals, don't you? And you understand how they are communicating with you.
Yes. And and it's ironic, isn't it? Because I don't talk about the fact that I do the job I do, and I have insurance for animal communication, teaching other people animal communication as well. And I don't think there's anything really unusual. I think we all talk to our animals and listen to our animals. Anyone who, those of us who have pets at home, who live with us, we know about our animals. We have a sense of them as both an animal, as whatever they are, the species, the cat, the dog, the horse, they are an animal. And then there is the soul and the spirit of the animal, which is somehow bigger than the animal. It's a soul having an animal's experience. And I think the reason for the rapport is, first of all, they're mainly non-verbal, and I talk a lot at work because it goes with the job, but my preference, because of possibly my childhood, is to not be verbal. And so just being quiet around animals is very helpful. Knowing that the majority of animals just like peacefulness.
So you yourself are comforted by the presence of animals?
I am, and I am comforted by the presence of animals because there's this mutual peacefulness. And that's why I'm saying any of us with animals, we know those moments where we are just with our animal, just with them. They might be beside us, or in the case of a horse, we're in the stable with them and just being with. And there's this lovely mutuality that is there, very gentle, peaceable. It's just being together.
you're kind of idealizing animals right now, because a lot of people find dogs frightening and horses big and frightening as well. But here you are giving this kind of very wide description of them as.
I'm very clear they're animals. I'm very, very aware of equine ethology and the behavioural science aspects and the size of their brains and their instinctual natures. And then what we were talking about was something about the quality of animals, not the pure, what I would call the animal science, which is really important.
Yeah.
We've got them both, and that's what makes them so fascinating, isn't it? Because there is the animal science aspect. There's the what's in the evidence base about what we know about them and how they behave. Yes, animals are instinctual beings, and knowing how what their behavior is saying to us, what they're showing through their behavior, what their state of mind is, and their levels of arousal. I'm thinking about horses. Horses are, horses are incredibly subtle with the signs they give, and they only show a large behavior like kicking or biting or bucking when there's been a very clear escalation from the very subtle, and anyone can learn to read those very subtle signs. You don't have to be a sensitive person.
Well, let me come back to, because I know nothing about the science, but I do know my own sense of anxiety sometimes, and other people's sense of anxiety when we meet a dog that's, bristles on the back of its, and you realize something's happening it's got a little bit of danger in the air. And horses are very big, and if I approach a horse, they don't know who I am, so there's something going on, right?
Yeah, you're approaching.
I'm approaching. The thing is, I know nothing about.
Yeah.
I'm speaking on behalf of all of us who have a natural concern and anxiety when we meet a big animal or an animal that goes into a defensive posture or whatever it is, and we get a vibe off it that's threatening. And yet you've just described this like very ideal relationship, and a lot of us are frightened.
Well, we build up to that, don't we? We build up to that level of peace and comfort with our pets. Let's be honest, we're talking about our pets. We're not talking about that dog down the road who always runs up to the gate and barks no matter what, And then let's also be clear, I don't walk through the village and all animals are immediately lying down and purring or, showing signs of complete relaxation. I am a normal person living a normal life, and I can.
No, I want you to be Dr. Doolittle.
Well, I'm kind of getting mixed messages here, because when I am Dr. Doolittle, then I'm idealising, and I am. So I think what I'm trying to say very clearly is that when we deal with animals, there's a real left brain and a right brain thing, and we've got to remember both. So first of all, maybe one of the things that I do when I'm around animals is, first of all, I'm very quiet in my body. And we do this, don't we, when we're about to do meditation, we just come home to our bodies, and you as a human, just being quiet in your body and having a peaceful demeanor that is not rushing towards the animal. That's the very first thing that is very, very helpful, because we are predators. Our eyes and our teeth are at the front, and so immediately the animal knows whether you are predator or prey. If your eyes are on the side, you are prey. if your eyes are at the front, you're a predator. We're on 2 legs, so we're already upright. And so in that respect, we're already in an offensive position. So having a quiet demeanour and having a peaceful and centered and quiet demeanour is the very first thing. And then, of course, animals, because of their survival, are aware of us way before we're aware of them. So that's also worth remembering, that by the time you see the animal, whether it's the neighbour's cat or, you know, the horse in the field, by the time you see the animal, it's seen you, smelt you, heard you, and been watching you.
I just put my phone on Do Not Disturb because of that ping ping that just happened. Sorry.
That's all right. So you know, that's just a way of being that is really easy to be. It's that round-centered caring. It's the attitude of care that we talk about often when we're talking about spiritual care. It's the attitude of care and just being gently grounded and peaceful in your body. And that allows you to see what the animal's up to and then watch and wait.
So what happens then the other way around when you're using horses in a therapeutic context?
Okay, so first of all, I'm not a therapist. So I'm an Equine Assisted Learning practitioner. So we have equine partners in a session. We don't use horses. We have them as partners in a session or as a co-facilitator. And so a session, because whether it's a therapeutic session or an equine assisted learning session, it has a framework that we follow. And the framework is that the person brings something to the session that they want to work on. So we have just like when we teach any lesson, we have an aim for the session and an objective for the session. And then we structure the session. And this is where it's like a little ritual, in that there's always a warm-up, there's always a setting of a goal, and then we move into the main activity, and then we do mini debriefs as we're going through the activity.
Can you give me an example? Can you give me an example of a goal?
I can. So a goal might be for somebody to really understand their strengths that they can draw on. And so that is part of emotional intelligence, that they want to really understand their strengths and to develop strategies to draw on their strengths in triggering situations, for example. And so what we do with the equine gives immediate feedback in the session. They mirror the behaviours, they mirror the congruency, they give feedback on whether what you do and what you say is in alignment.
Can you just pause a second? Because you're using language that for me is a tad technical. So there's the person, you're there with the person and the horse. And you're in a field or a enclosed space, or what's it actually look like?
What it looks like, so you can be in a field, you can be in an outdoor arena, you can be in an indoor arena, but what you probably are not expecting is that the horse is at liberty. The horse is not on the lead rope. They might arrive, if they arrive into the space with the participant, they might come in walking in with an equine support person, but they're at liberty.
So the horse can choose what it...
The horse chooses what and how it relates to the person.
Okay, so there you've got the person who wants to build the stuff you just described.
Mm-hmm.
They're in this space. You're there as assistant, supporter, whatever you have a
I'm a
special name for it,
facilitator.
facilitator. There's the horse,
Yep.
and the person. What you said, what happened was a minute or so ago. You said the horse gives feedback.
Yeah, that's right.
What does that look like?
What does that look like?
Yeah.
So, as I say, there's a framework, and the person will say, for example, they want to understand their strengths, and so what we'll do, we'll set that up, and they might want to identify 3 strengths. And so we do a setup, and we'll put cones out, and each cone might represent a particular strength. And
so these are literal
little cones. That's right.
And you put them on the ground.
Yeah.
What kind of distance between them?
Well, you let the participant do that for themselves. You say you're going to put out 3 cones, which represent your 3 top strengths that you think. They put out their cones, and they don't have to tell you even what the cones represent. And then you ask the participant to walk to their first cone and see if they can invite the equine to join them, or think about using their strength in an everyday situation. And the moment they start moving, the equine will start giving feedback on what's really going on. So people might rush to the first cone, and you might see an arousal from the horse, so you might see the horse move away. And sometimes we do invite them to lead the horse loosely, and the horse just might not want to go there. And we don't ever make the horse do anything at all, because they are the facilitator. And so there might be something, for example, that a participant identifies as a strength, but the horse doesn't want to go there and isn't going there, and is just standing still, and they want to walk, but the horse is not. And so then in a debrief situation, immediately you'll be saying, what do you make of what the horse is doing here?
So do you do the debrief or the processing while the horse is there, or separate?
Yep. And then you repeat the activity and you debrief, and what happens is you uncover what is really going on. So somebody might, for example, say that one of their strengths is being optimistic, but the horse is just not moving to the cone that represents optimism. But when they move towards the cone that represents, let's say, for example, resilience, the horse goes really easily.
So the horse is mirroring the unconscious process of the human, which is manifesting through very subtle body language that the horse picks up.
Yes, exactly. And is also highly attuned to whether your internal state, your heart rate, your blood pressure, your body temperature is congruent with your movement. So you might say you're perfectly at ease, you might be saying that, but everything about your physiology is saying that actually you're not at ease. So why would that horse go with you? Something you're deeply uneasy about.
So do you have some horses that are better at this than others? And if they are, why? How come? What's going on?
It's very important. It's a very important part of this facilitation that you carefully choose the equine partner depending on what the person is bringing. So, for example, at the Mare and Foal Sanctuary, we have a number of pony mares who have maybe been in foal out on the moors and came in sanctuary with their foals or to give birth. And these pony mares, they are wonderful at spotting when people are nervous, and they're just really gentle. And they slow down their signaling and thereby they just slow everything down. And then somebody who's just a bit nervous or wondering what's going to happen in their session, then that person can see really easily what the horse is showing. So I would partner one of those pony mares who's seen it all, heard it all before, with somebody who's a little bit anxious. And then we have some of the horses and ponies where if somebody is a little bit overconfident and a bit, just a little bit overconfident or a little bit pretending they're overconfident, but really they're not. Then again, we have some equines where we have some equines who are really good at picking up on that incongruity and just move away. So if somebody is too full on, that equine will just move away.
You've gifted me a session.
I have.
So I'm coming down in 2 or 3 weeks to have a session. Have you already tuned into which of the equines will be able to facilitate me?
I've already booked
You already have.
In the diary, yeah.
How intriguing. How intriguing.
Unfortunately, our equine William is not on the team at the moment, but it was going to be William because we if the horses have breaks themselves from being involved in sessions.
I can believe it. Well, we need it, don't we, as well?
Yeah, we're very, very careful about what they do and the breaks they have.
Oh, that was wonderful. Listen, we've gone for 55 minutes. People listening, do you have any questions you want to put in the chat box? I haven't looked at the chat box to see whether there are any. Have you looked? Are there any questions that you've noticed, Sahini?
There's a couple. There's one question, which is, what qualities in a horse do you recognize as being particularly helpful to work with in your setting?
First and foremost, the equine has to be oriented to people. There are many equines, particularly because we work with rescued horses and ponies who have been through a rehabilitation. And there are equines who definitely show an interest in people and those who definitely don't. And so first and foremost, it's somebody, we speak of them as sentient beings, and so it's an equine who is interested in people.
Are rescue horses, asks Liz, better at this than ones from a happy home? Is there a pattern there that you can discern?
This is a subject that needs a lot of thinking about. So there are a few organisations like ours who do have rescued horses, and we know those rescued horses really, really well. We've known them for years and years, and they are with us for life. And so it's not necessarily that they are better. Some people doing this work would not have rescued equine partners. So in that respect, they might say that it's if you don't know the horse's background, you don't know what triggers the horse, what its trauma is, well then in that respect, you have to know your equine. You have to know something about their history, what they enjoy, what they don't, what triggers them. So it's just like when you are in a team with any human, and you have to know your human collaborator. It's the same with the equine. So just you have to know them.
Thank you. We've got a few practical questions coming in about, can they get involved with your charities. There are trainings like this in the States. And I think what we'll do is say, we'll send out an email telling everybody who's booked onto this session, we'll send an email out to you when the recording comes in, and we'll put in some links in that email to how you can find out more about what Sarah Jane's just been talking about. And James, having apologized for being silly, I do want to say, James, that you're right. There was a talking horse in America called Mr. Ed. Do you have any horses who talk? And he then recognizes that that was a silly question, but I did want to name it. Do you have horses that are, I think this is kind of my final question as we move towards the end of this conversation. There's a interesting theory in Theosophy, Alice Bailey, Anthroposophy, that when animals are preparing to take their next stage, evolutionary step forward, that one of their symptoms, one of the pieces of evidence for them about to reincarnate as a more sophisticated type of being, is that they show great affection and devotion to a person, a human being. Do you have a sense of the soul's journey of an animal that you can say something about as the kind of the last? This is the last question.
So this is a purely personal sense. Every soul is on an individual journey, and some of the most devoted horses that I've known, and usually in private homes, their last life was as a human. So it's interesting, because what's in Alice Bailey and Theosophy doesn't seem to match. And then for sure, there are horses who have had many lives. My personal view, I believe in reincarnation, and you see horses who've had many horse lives over, and they've maybe done other things in between horse lives, but actually they've generally been horsey, or they've got a really strong link to the horse species. And they have really a depth of soul quality. I think any horse owner, there's a couple in the audience that I recognise, any horse owner would tell you there's a depth of soul to a horse that really is beyond anything else when you get to know it. And it's not just, there are special horses, but actually it's most of them have this real amazing depth to their being and to their souls. And so there's something about incarnating as an equine, and an equine's a horse or a pony, that somehow gives this depth through the life experience they have.
That's a beautiful note for us to move towards conclusion. I'm going to spring something on you, Sarah Jane. Say no if it's not right. Do you have a prayer or a mantra or something that can just guide us into silence? That kind of threads together what we've been talking about as a mention of the animal realm? I've sprung it on you, so you can push it back if you want.
No, well, I can make something up, but I've spent a lot of time talking about how it's not verbal. And so, when often we go into silence around the equines at the start of a session, and we just go into a mindful moment. So we wouldn't use forms of words. So I can do a verbal blessing if that will suit the humans.
Yeah, do us one for the humans then.
One for the humans. All right.
Do us one for the humans.
Okay. So everyone, please bring to mind a horse or a pony or a herd of horses and ponies. And be aware as you bring them to mind how much they represent the earth on which we live together and how connected they are to their environment, to the natural environment. And be aware of how we share space with them. And be aware of the years of history that we have between our two species and the way that horses have been companions and servants of humans over the centuries. And I would invite you to express gratitude to that species. And just see if you get anything as you do that. Thank you, everyone.
Thank you, Sarah Jane. That was a useful reminder. That last few seconds. Thank you. So thank you very much, Sarah Jane. Thank you, everybody.